If you have back pain that gets worse if you stand too long or you go on a long walk and it gets worse, you may actually have spinal stenosis or degenerative disc disease. In both these conditions, your back is going to feel worse generally when you're standing upright for long periods of time, and it's going to feel better if you're kind of bending forward a little bit. In this video, I'm going to show you 5 exercises that will not only help you feel better, but it'll help you move better if you have spinal stenosis and degenerative disc disease. I'm Dr. Sean, your PT guy, and our videos help you learn how to move better and stay independent so you can enjoy your life. Let's get started. Disclaimer! So what exactly is happening with spinal stenosis or degenerative disc disease? When you have spinal stenosis, essentially the back part of the spine is narrowing down and it's pinching down on the nerves. Let's see on Bob here for a moment. This is a vertebral column, and all these little yellow guys coming out are your nerves. And in this model, the gray is the disc that sits in between each vertebra or backbone. So you've got your neck, the mid part, and the lower part, the lumbar. And typically most people have a lot of stenosis down in the lower region. As we age, some of these joints can get a little bit gnarly a little bit. After repetitive use and stress and all these things, they can get a little bit worn. And what happens is these nerves, when they're coming out, they can get pinched because all these little bony structures in here are becoming bigger and bigger and bigger, but the nerve can't get smaller and smaller and smaller, so there's not enough space. So it pinches down on that nerve, creating that sharp and achy pain that you just got to sit down for some relief. So let me show you on this other model here what is going on. Now, on this model, you see a red disc. You've got the bone, and the disc here. Squishy, right? So here's the spinal cord in yellow. And if you look up close here, let me zoom in here a little bit. This bone, if I lean forward, see how that opens up that space? But if I lean backwards, it's going to pinch down. If I lean back, it's pinching. So you can see here, when I lean back, that little nerve in there, he's getting pinched. No thanks. That's where you get that pain. So if it's constantly worn back there and you're getting pinched back here, that nerve is going to tell you that's where you get that pain. So that's why when you see people walking at the grocery store, they're usually kind of bent over a little bit, and what's that doing? It's actually opening up that gap. It's gapping open that space. So now the nerve is moving, he's all happy, he's able to move freely. Great. So how do we help this? How do we get this area a little bit more open so that we can actually have that nerve breathe and move and feel better? That's where the 5 exercises come in next. Now the main principle that we're going after with all of these exercises is to try to show you exercises that's going to help open up this space so that the nerve can move better, can breathe better, and feel better. So the first exercise that I'm going to show you is called a posterior pelvic tilt. Most of the exercises we're going to do right here, but I'm going to show you this one standing up first. Now with this first exercise, I want you to focus on how your lumbar spine moves. Notice your curve at your neck goes forward, it comes back, and then it comes forward again, and then it comes back. So there's a small of the lower back that we have, a little groove right here. You're trying to basically flatten that out, okay? So you can kind of see with my belt line here, typically they're pointing down like this. That's an anterior pelvic tilt. What happens with that is you're pinching down. If I do an anterior pelvic tilt where I'm coming forward, I'm basically doing one of these. Smush. See? Smush. So I don't want to smush. No thanks. No smush. So I'm actually going to go back. okay? I'm tightening my glutes, and I'm basically trying to flatten this lower back out. Now this is really hard to do, to keep this position and to keep this open, but it opens that gap up in the back, okay? So when I do a posterior pelvic tilt and hold it, what I'm doing is I'm going like this, and I'm keeping that like that, and you can keep that like that as you're doing activities. It's very hard to get used to, but once you are used to it, it's easy to maintain that. Plus, it's going to feel better. But let me show you a little bit of an easier way to do this, to learn this on the bed. So an easier way to learn the posterior pelvic tilt is when you're laying down. When you're laying down, you want to put both feet basically on the treatment table or the bed, wherever you're doing this. And when you first lay down, you're likely going to be able to stick your arm back or your hand back underneath your small of your back because your back naturally curves like that. But with spinal stenosis, you actually want to press that lower back down, okay? That's just, I'm dipping my pelvis back and down so that I can't fit my hand underneath anymore. So when you first come in, it's easy to put it down. But the exercise itself is squishing it down like this, okay? Hold that for a few seconds, come back up. Push down, hold it for a few seconds, come back up. 10 repetitions. That's the first exercise, a posterior pelvic tilt. Now, building off of that posterior pelvic tilt, we're going to incorporate the next exercise. I call this the pelvic dips or the knee dips. It'll help you remember how to do it. So you're going to lay on your back in a hook-lying position like this. You're going to put your feet together and your knees, and you're going to do that posterior pelvic tilt, and then you're going to dip your knees over to one side like this. Make sure your shoulders stay on the bed. And if you're doing this on a table, be very careful. You don't want to roll off. Okay, no falls. We don't want to fall. You're going to hold this, and it's going to stretch this side. Feels great. Now I'm maintaining that kind of posterior pelvic tilt while I'm doing it. Then you're going to come on back over to the other side, and you're going to go all the way over, dip. Okay, dip those knees down, 30 seconds, or take 4 deep breaths. That's great. So you want to do this 3 sets. So you come back up, you dip it down, okay? We're on our second set. You do 30 seconds, go to the other side, 30 seconds, and then 1 more, okay? So now, our third exercise. Now the third exercise is called the single knee to chest or the double knee to chest. I'll show you that in a moment. So what you're going to do is you're going to lay on your back in that hook-lying position again, do your posterior pelvic tilt. While you're doing that, you're going to bring one knee to your chest. You're going to hold it like that. Don't hold right here. If you hold right here, it's going to put a lot of excess pressure on your knee. You don't need to do that. We don't want knee pain. No thanks. So we're going to hold right here and bring our knee back, okay? 30 seconds or 4 deep breaths. And then you're going to switch to the other side when you've done that side. And you're going to do this side to loosen it up too. You should feel a pull in your lower back. Again, 30 seconds or 4 deep breaths, 3 sets. So, single knee to chest. If that feels like it's not enough of a stretch, do the double knee to chest. This one's a bit tricky. Hold underneath, don't roll off. Hold and pull back. Now, bring your, you may have seen my bottom come off the bed a little bit, just a little bit. This one's a tough one. So you're stretching that lower back and you're just holding it. 30 seconds, 4 deep breaths, 3 sets. That's the third exercise. On to exercise number 4. Now this exercise is a great and fun exercise. I love doing this one with my daughter. It's called the dead bug. Yep, dead bug. So you're gonna lay on your back, posterior pelvic tilt, flatten the small of your back, and then what you're gonna do is you're actually gonna bring your knees up like this, okay? And then you're gonna bring up your arms, all right? Now, this one's a little bit tricky, but it's so helpful. So you may not be able to do all of this. You may just start with your knees like this. You're gonna drop it down, okay? And then the other one, like this, okay? You see how I kind of look like I'm a dead bug that's squirming? Well, I guess the legs wouldn't be moving if it was squirming, but this is what the kind of half of the dead bug. But if you can do that, that's great. Then you try to do this, okay? You're gonna bring one arm down while the other one comes up, okay? Like this. And then like this. Ooh, see that? I almost messed up, okay? Now, it takes some coordination like this, okay? Like this. All the while, you're maintaining that posterior pelvic tilt. This is called the dead squished bug. So, exercise number 4, how many? 10 repetitions. This one's tough. If you can't do it with the arms, just do it with your legs. Posterior pelvic tilt, up. When you've got both up, dip, okay? Like this. Okay? Great exercise for spinal stenosis and degenerative disc disease. Now, on to exercise number 5. Now, this exercise is great for opening up that space even more. We're going to use a table with a pillow, or you can use the side of a bed or a couch, anywhere where you can put your top part of your body on it and just hang down. What that's going to do is when I go down, okay, when I go down and I let my bottom part of my body sag down, look at all that space. That is just opening up greatly when I do this. So what is that going to look like? I'm going to put my pillow down here so it doesn't jam into my hip bones, the front of my hip bones right here, or my belt line. And you're going to come down on your forearms first, all right? And you're just trying to put your pelvis, the lower part of your pelvis, on the edge, all right? So from here, you notice my tippy toes are down on the ground, and I'm either holding on here, which feels better for a lot of people, or you're right here. I like to hold on here, and I'm just sagging my bottom down and my knees. I'm just letting my knees hang down towards the floor. Now I'm holding on, so I'm not falling down, but the weight of my lower body is opening up that space, and it feels great. You can just hang out here for like 30 seconds, a minute. You may want to hang out here for 30 minutes. I wouldn't suggest 30 minutes. Maybe 2 minutes max. And then from here, you're just going to have to be careful getting up. So you're going to come on up, slowly bring your feet forward in front of you. Okay, you can use your hands. Walk your feet forward. If you're doing this with socks, be careful they don't slide. It's better with shoes, or take your socks off, but shoes are good. That'll keep you kind of gripped to the floor when you do this. You don't want to slide as you're trying to come back up. We don't want to fall. So this is a great exercise to improve and open up that space even more. Now, bonus exercise. Now, as a bonus exercise, I'm going to show you one that I show a lot of people who have sciatica. Now, if you have sciatica, it can be coming from pinched nerves, just like spinal stenosis. So I'll put a link to that video at the end of this video, but for this one, it's called the Piriformis stretch. What you do is you lay down on a couch, bed, table, wherever you want to go, floor. You're going to lay down, and you're going to stretch both sides. So you start off in a hook lying position with your legs like this, your hands like this, and you're going to take the side of one ankle and put it over your knee, all right? So it looks kind of like a figure 4. You may have heard of a figure 4 stretch, Piriformis stretch. This is great to open up that spot. So what you're going to do, you're going to try to push down a little bit. That one you may feel a little bit tender, but the one that is really great in this position after about 30 seconds is pull from right here. Oh, yes. So what that's going to do is it's going to open up and turn the spine a little bit to make the right side open even more. Great. Now, we always want to do the other side as well. So you put your leg down, you bring your ankle up and over. If you can't bring it up so high, just bring your leg down a little bit. That's okay. So you're going to go right here, push down a little bit first. Try to keep the small of your back pushed down, okay? And then from here, after 30 seconds, pull. 30 seconds. And notice my ankle stays at my knee, okay? I'm pulling right here. And I feel that open up at my hip, my lower back. It just feels great. So, bonus exercise. So those are 5 exercises that will help with spinal stenosis and degenerative disc disease. If you found them helpful, let me know in the comments below. I'd love to see that. And if you want more videos just like this one to help you learn how to move better and stay independent to enjoy your life, click the subscribe button down below, and we'll see you in the next video.